Hello, today I will be talking about my risk assessment project regarding my patient. Here are the table of contents of things that we are going to be reviewing, introduction, and my patient. So I do have a 20-year-old female Asian patient. She had no chief complaints. The patient hasn't been to a dental office since 2019 due to COVID. She does have a history of asthma and no history of past surgeries. Regarding her medical assessment and periodontal assessment, medications include bronchodilator as needed. Baseline vital signs include BP 118/78, pulse 80, respiratory rate 14, her O2 98, all within normal limits, and I would classify her as ASA2 because she does have a mild systemic disease. Regarding her periodontal assessment, extraoral exam, she does have TMJ slight deviation to the left, no discomfort. IO exam within normal limits. Classifications include that right and left canine class 1, right molar and left canine class 2, and maxillary free and maxillary attached. Gingival descriptions include pink, firm, stippled, knife edge. Her mandibular free and mandibular attached. She did have red, firm, stippled, but her contour was rolled borders on her mandibular anterior teeth. Also including the initial plaque index that I found was 51%. Regarding inflammation, she did have on her mandibulars, localized on the mandibular anterior teeth, slight recession on tooth number 26. Mobility was barely discernible. And then I would classify her calculus as light 1, or for maxillary light 1, and light medium, localized on her anterior teeth. AAP classification was stage 1, WLA calculus code, light 1, light medium on her mandibular anterior teeth. When it comes to her oral hygiene instruction, I did recommend that she use a modified base technique and also a gum stimulator because she did show her skills on a typodont and she does use an electric toothbrush, but she did show the scrubbing method. So I did introduce her and showed her how to use a gum stimulator because she does have mild inflammation on her mandibular anterior teeth. And just told her it just strengthens the gum to protect against infection and also helps by assisting food and plaque removal. And then in regards to the modified BAS technique, I just showed her to place her toothbrush at a 45-degree angle and use a gentle circular movement as she brushes each tooth. And then when she's finished, just flick the toothbrush down the tooth away from the gum line. In regards to her dental hygiene treatment plan and process, I scheduled my patient as 4 appointments within her treatment plan. Her progress did improve from her initial plaque index to reevaluation. It did increase. Probing depths have not changed. And then marginal bleeding index has also decreased from the initial appointment. Regarding nutritional counseling, here I present the first initial 3-day set of diaries, majority consumption of carbohydrates. She does chew a lot of gum, which I found really interesting. So I did introduce her to xylitol gum, introduced her to complex carbohydrates and more homemade meals. So within her second nutritional 3-day diary, she did show improvement but did not meet her daily nutritional goals. But the patient did follow recommendations to introduce xylitol. And then here are the intraoral photographs that I took regarding her case. The only interesting thing that I noted that she does have possible sealants, and this looks like staining, but it could not be when I went in to examine. And then here is her plaque-free, her plaque index ones. And then this is her full mouth x-ray. Nothing was really significant. I did not find anything pathological or any lesions. Just minor horizontal bone loss, but everything appeared within normal limits. So still classify her as stage 1. Regarding the summary and research articles, I did find the correlation between asthma and oral health. So I just saw that my patient does have mild intermittent asthma, which may be one of the reasons she does have mild xerostomia. So in general, in regards to my research, I did find that asthma can lead to a lot of oral health problems. So in regards to dental hygiene management, I would just assess the patient's risk to asthma before dental treatment, monitor their breathing and avoid obstructing airway, recommend that the patient bring their inhaler to every appointment, and then make sure to review if they're taking any medications. The interesting experience that I had with my patient was to see their own nutritional dietary consist of chewing gum on a daily basis. It was nice to see that after I introduced her to this specific brand in general, that she likes it better than her sugary 5 gum that she would consume, and then that she did show improvement within her plaque-free index because it did decrease. I just found it interesting since she does chew gum on a daily basis, but when I first saw her in her initial appointment, she did not have any presentable dental caries, which I find really funny as 5 gum is very sugary. Here are my references, and thank you so much for listening to this presentation.